Our president, who is a champion for HIV prevention, particularly among young people, has committed that he wants Kenya to be the third country in Africa to end AIDS as a public health threat by or before 2030. We never share on that commitment to be the third country in Africa after Botswana and Namibia to end AIDS as a public health threat. And we think that DTG is coming at the time to help us fulfill that dream and ambition.
The type of patients we started off with are not the same as the kind of patient that we see today, who is essentially somebody who's going about their business but happens to have HIV but is still relatively well. At that time, HIV treatment was essentially a matter of life and death. You know, patients were immediately at risk of dying if they didn't receive treatment. One of the first evolutions that we had in treatment was the introduction of tenofovir to replace stavudine, and that has reduced the stigmatizing effect of that drug.
The moment I use drugs and keep my time, I'm very okay.
Part of the evolution of treatment for the HIV patient has been the increasingly friendliness of the regimens that are available for the patients in terms of toxicity and therefore their capacity to stay on it for the long term.
We are indeed actually celebrating many milestones. Among them, of course, is introduction of innovations, new regimens that are simpler. We do have collaborations with the PEPFAR in terms of financing as well as Global Fund.
Okay, so the first case is one of a 48-year-old female.
The Clinical Health Access Initiative, CHAI, have also been key partners in terms of market survey, guiding us in terms of pricing for HIV commodities. Unitaid has, of course, been a key partner in terms of championing for innovation and new products, and we are very glad to be partners in the introduction of TTG.
Kenya has been at the forefront of the HIV response in the African continent from as far back as 2003. We started out our relationship in about 2007, where Kenya was one of the first governments working with Unitaid to introduce and roll out new pediatric formulations for HIV. And here we are today, another milestone in this partnership, launching Dolutegravir.
The biggest milestone in HIV in Kenya has been the scale-up of treatment. So we celebrate that, and as part of what we are celebrating now is what we've been able to achieve through the ART program.
Yeah.